Hi, I'm Dustin. I'm a respiratory therapist, and I'm going to go over with you this question I got. Hey, I've been having trouble breathing. Is it that I work on a farm? Have anything to do with that? And it's true. Farmers do deal with lung concerns that have baffled doctors. And farmers have actually been exposed to more chemicals than any other profession in the United States. So it's very critical to recognize that the harm that they're experiencing is real. So I'm going to walk you through what might be causing these things. The first thing is dust. Farmers deal with a lot of dust, especially during the dry seasons when they're not actually producing crops. And also because the cattle around them and the soil particles, the animal dander, all these are small particles that can get deep in your lungs. These are basically particles that aerosolize and you suck them in. What this can lead to is airway irritation and chronic coughs and inflammation. We don't like that because that can lead to chronic reshaping of your lungs over time. Another thing they experience is mold and hay exposure, especially with damp hay, gets moldy, and that causes inflammation. And mold is very pungent and hard in your lungs. You also can see it in your silage, stored grain, and this can lead to a condition called hypersensitivity pneumonitis, also known as farmer's lung. These symptoms are shortness of breath, fever-like feeling, fatigue, cough after exposures. Another thing they are exposed to is chemicals. They use pesticides, herbicides, fertilizers. Wow, these are very irritating to your body, trigger asthma-like symptoms, and after long-term lung health, and affect your lung health for a long time. The animal environments themselves, you can get ammonia from the waste, bacteria in enclosed barns. These gases and particles can inflame your lungs over time. Diesel exhaust and equipment tractors provide you oil fumes that can cause coating in your lungs. These are the volatile particles you don't want to inhale, and that can actually affect your airway and your blood vessels. So what can farmers do? If they're the most exposed profession in the United States, what can they do? Well, I recommend an N95 mask isn't enough. I would use a high respirator style mask with removable cartridges that have expiration dates on them. You have to protect yourself thoroughly. Your lungs are the first gateway to all these exposures and causing long-term effects. Improve your ventilation. Open the barn when possible. Use fans in enclosed areas and avoid working in heavy dust clouds. Wet down dusty areas. Light misting reduces airborne particles, especially helpful with sweeping or feeding. Change your clothes and shower after work. I do the same thing too after work. I work with patients who I don't know what they have, and I just change my clothes. Remove particles from your skin, and your hair helps it from you not having to absorb it later, and prevents these contaminations in your home as well. Rotate your exposure when possible. Limit time in high dusty areas and take a break. Take breaks in these clean air when you got to work for a while. Hey, I got to go on a break. Rotate. You're a hard worker, but remember, you have to keep going to provide for your family. So please take care of yourself. What are some medications providers might prescribe? They might give you your bronchodilators to help relax the lungs. Inhaled steroids like corticosteroids to help reduce inflammation short term. Sometimes antihistamines to help with hay fever and allergic reactions short term. Sometimes you might even get steroids for bad reactions that are more systemic side effects. They just treat it short term. The most important thing is to reduce exposure. Okay? Protect your skin, cover yourself up, protect your lungs, wear high quality respirator masks. Now, nutrition is also really important for you to boost your immune system so you don't react as strongly. This could include vitamin C, omega-3s, magnesium glycinate, vitamin D3. These are all excellent things to help support you. Eat whole foods. Stay hydrated. Avoid other toxins. Don't decide that, well, I'm a farmer, I'm not going to go smoke and vape on the side. You need to give your lungs a break to heal. Be careful of enclosed chemical exposure. If you'll be careful of those type of things, for example, cleaning products that are volatile. Bleach, Lysol, Fabulosa, these big name products have volatile chemicals that are not good for our lungs. Be aware of burning materials like trash, crops. You've got to be careful with that with your lungs. Those are not good for your lungs. It can cause scarring. When should I get checked is a great question. Don't wait. If you notice persistent cough, shortness of breath worsening, chest tightness, fever after exposure, early care can prevent long-term damage. First thing you can do is after you ask for help, you need to cleanse your body. A nice warm shower, okay, cleans your body out. Then you need to flush your nasal and your mouth airway. So you clean your mouth normally, like you brush your teeth, gargle, spit. Then you need to flush and clean your nose. This is through a nasal flush technique I call neti pot. You can use a syringe or the pot itself. You got to clean your airway out. You got it? You got to get all those irritants out. Then go seek help go seek help to help treat the fever, the allergic reaction, and the other symptoms you might be experiencing. Farming builds and sustains our life. I'm so grateful to have farmers. They're the foundation to America. Protect your lungs, farmers. Please. I want you to be smart when you farm. You have this tool now to guide you. And I'm so grateful to help you continue to work and provide such wonderful resources for us. Thank you so much for providing for us. And I'm so grateful to help guide you and help you bring health back to you and your family. Thank you and God bless.